our people don't actually know what is called a breast self-examination. Breast self-examination is a common definition, is what a client, some people prefer to call people clients instead of patients. Because some people may be angry or they feel embarrassed if you are calling them a patient. Say, am I sick? So the person is not sick. So some people would prefer to use the word client. Okay. So breast self-examination is a situation where these clients can be able to examine their breast regularly on their own. And it is being taught. It is not something you begin to do by yourself, because there are techniques of doing it correctly. If you don't do it correctly, then you may be able to feel something that is not there in the breast.
Yeah. All right, doctor. So eventually we will get to the point where you would have to, teach people how to do. Actually, I'm sure you can do it here.
Of course, why not?
Yes. So, okay, now you said something about having to have breast cancer as well, and I'm very sure a lot of people don't know this. How is the current awareness of breast cancer in Nigeria right now, and from your own experience, how prevalent is it?
Well, breast cancer in our environment is, you would say that majority are underreported because of the belief system people are having. Many people, when they have these lesions, they don't go to hospital. They either go to a prayer house, saying that maybe a witch in the village is after her or after him, so to say. So majority that actually eventually comes to the hospital comes at a very advanced stage of the disease. And quite unfortunately, there are few individuals who actually come to hospital early. The doctor will do their examinations and investigations and find out that this patient has a breast cancer. From all the gamut of investigations they have done, including taking part of the tissue, from that to do a histological diagnosis. And it is discovered at early stage. Breast cancers are curable when it is discovered at early stage. But we've had unfortunate incidents. People that actually came to hospital, the diagnosis was made very early, at early stage, and now we offer them the treatment protocols. They will say they are going to discuss that with their family and friends, and they go home. Next time you see them again, maybe a year after, or 2 years after, and when you see them, by that time the breast is already ulcerated. There are wounds in that breast. Smelling, the cancer has already spread from the breast to the lungs, to the liver. Some it has even gone to the brain.
So from breast cancer, it can go to the brain?
Of course. Because we have what we call hematogenous spread. That is something that goes through the blood. Blood is heme. Yeah, medical balance. So, if something goes into the blood to circulate, it can get anywhere in the body, because every part of the body receives blood for it to be alive. So, if you put something in the body, it's going to get into every nook and crannies of the person's body. You see. But commonly, they get first to the lungs, because the lungs and the breast is close, are in the same region. That's the most cases, the first place, you detect that. Then down to the liver. The liver is also highly vascularized. There are a lot of blood flow to the liver itself. So when this individual now comes, they will now be telling you, doctor, I went and I meet my pastor. The pastor says he's going to pray for me. I meet this person says this. So that woman has been going from one prayer house to the other, going from one traditional people to the other. And they are proposing that the cancer will be cured, either by prayers or by their magics. And the woman believes that. And some are too gullible that when they look at their breast, this is growing. It's getting bigger. And they're still telling you that it's going to work. Whatever they are doing is going to work. So many a times before they now send them to go to hospital, is probably if they're in all these traditional places, they used to treat people. So if the order becomes so much that the family of the person who is taking care of the woman begin to complain, So they will now tell the person, okay, you can go to hospital. Then that they've come out all the spiritual thing that if you now go to hospital and doctors start giving treatment, you will now begin to accept treatment.
Okay, so doctor, let's talk about symptoms, especially for men as well, because just like you said, men's zone is immediately they start, it's almost cancer immediately. Yeah, so what are those early symptoms, both for men especially, then women as well?
Well, the symptoms are very simple. Once there is any growth in the breast, no matter how small it is, that's why the breast self-examination, as we discussed, is very important, both for men and women. Because if you are fond of looking into yourself, then you know how your breast looks like. When you begin to have changes, you'll also notice that. So the commonest symptoms they present with is a lump in the breast.
Both for male and
both
female.
Male and female, yes. So there's something, there's something in my breast. I feel it. It's like a ball. It moves around.
It doesn't have to be big.
It doesn't have to be big. It can be as tiny as seed of a bean. Bean seed.
Wow.
As small as that. And do you know the funniest thing? It's not painful.
I think it's high time you teach us how to examine ourselves. Yes, it is.
Yeah, okay, so the examination, particularly for men, it doesn't have time or specific time. You can examine yourself at any point in time. But for females, you don't actually start examining yourself when you are in your period. Because during your menstrual cycle or menstruation, there are changes in the breast because of the hormones. So it is advised that you wait 3 to 5 days after your menstruation, yes, so that those changes in the breast will return back to normal. So that as you now examine, you will not be able to find something abnormal, because those changes actually looks abnormal in somebody who is not a professional. Okay. So the breast is divided into quadrants. And what we mean by quadrants, if you divide something into two, vertical and transversely, okay?
Yes.
Okay, so you have 1, 2, 3, 4 quadrants.
Yes.
And the center, where the nipple and areola, the dark spot, is called that place central. Okay? So these quadrants, you can actually do it standing up in front of a mirror. You're looking at yourself. So use your sense to divide the breast into that 4 quadrants. Okay? Then you position your hand. This is where people make mistakes. People go poke. They use tip of their fingers to examine. This is what they do, and they say they're doing examination. That is not proper. Because with this, you can mix the lump when they're held, because they will small. So if you poke like this, the lump will shift small. So you won't catch it. You understand?
Yes.
So the proper way to examine is to put your hands together. Something like this, pop, flat. Okay?
Yes.
You now rub. Say this is the upper inner quadrant. You feel. See what I'm doing?
Yes.
You feel at that quadrant. With this, if there is any lump, you will feel it, because there is sensation in our hands. Okay? And this is what you do in your bedroom. So you are not wearing clothes. So it is skin to skin. So the sensation is very high. And you are positioning your hands in a good way, not poking. So it should be flat and the pop. So you rub this quadrant, you go to the outer quadrant in the upper one, you go to the lower one, you shake, you go to the what? The media aspect, and you shake, then you come to the center. Yes, and you rub as well. Okay? Sometimes you can go ahead to milk and see if the anything is going to come out from the nipple. There are people who have nipple discharges. It can be spontaneous, that when you pull out your bra, you see that there are fluids in it. The fluid can be clear fluids, it can be milk, and it can be blood. Okay, the worst of all is the bloody discharge.
So what are the causes for each different ones, the milky, the normal, and the bloody?
Well, the majority of the ones that are clearless, or sometimes they will have a milky coloration. Majority of them are due to physiological changes in the body, especially when the individuals is having a high hormone level, what they call a prolactin. Okay, prolactin is a lactation hormone. Lactation means breastfeeding, production of milk. So people who are pregnant has high level of this hormone in their blood. But for some reason, somebody who is not pregnant is now having high level of this hormone in their system. It will result to milk production. Meanwhile, the person is not pregnant. The person is not nursing the baby. Okay? Though it's not something, so bad per se, but it has a medical treatment. Okay? So these are the benefits that the individual will get if you are doing self-breast examination. Whichever one you discover, you simply go to the hospital and see a doctor. The doctor will examine you, ask you some questions, okay? And do some text investigations to say, okay, this one you have doesn't have problem. If it is high hormone level, they will give you a medication that will go and reset that hormone to go to the level, the normal level that is supposed to be in your body. And those things will stop.
Okay, Doc, when you talk about level, are there stages of cancer growth? Is it a particular stage where you can say this lump is not cancerous, or it is cancerous, or it is treatable?
Well, there are different stages of cancer, but that is going into the medical aspect of it, which may not be very well understood by public who are not trained. But I'm going to summarize it in a layman's way so that people can actually understand. If you have a lump, most of the lumps you have in young ladies, people who are less than 30 years, majority of those lumps are not cancerous.
Okay, before you continue, is breast cancer, is it age specific? Is there an age to it?
Well, it is actually not age specific, but it is common in people who are above 40 or 45 years of age. That is not to say that you can't find it in younger people.
But how frequent is it, rather, to find it?
It's not very common.
Okay, it's not common.
In younger people. But even recently, the trend is becoming outrageous that more of young people are coming down with actual breast cancers.
Before you go to the stages, what are the causes of breast cancer?
Well, there are no known specific cause as it is for now in literature. But there are things we call risk factors. These risk factors are things that if you have it, you have a higher chances of developing breast cancer than other people who doesn't have those risk factors. Okay?
Yes.
The commonest one is the familial. If somebody in your family, let's say your mother, has breast cancer, it means that the girl child from the woman has higher chances of developing this breast cancer than other people in population. This is one of the strongest risk factors in terms of breast cancer, because there are genes that have been discovered. They call it BRCA genes. Have the common type BRCA1 and BRCA2 genes. That's what they call it. And that's why if you have people who follow the social media events, you see that some people in the Western world go for what they call prophylactic breast mastectomy, that's removal of the breast, when there is nothing in that breast. Okay, simply because they went for this gene test and found out that this gene that predisposes individual to develop breast cancers is in them. Meanwhile, they haven't developed anything. They opted that their breast should be removed.
And is it better that way? Is it better that way? That's like cutting the head of somebody who says they have headache.
Hey, well, my brother, this is something that is about choice and priorities, and it's about a level of experience and exposure. People who are in Western climes, they have information available to them. They have a strong health system. And some people, will say, I would rather not see this come. I would rather prevent it from the beginning. If I'm in their shoes, I wouldn't go removing my breast, actually. That's my own personal opinion. But all I do is to do what? To take all the precautionary measures and monitor myself. Whenever I have any changes that were not there, I will present myself to the doctors early. But that is my own take. Well, in those areas actually there are what we call a breast implants. Even if somebody has removed the breast, it doesn't mean that the chest will become flat as a woman. You have a social aspect of it. Okay, so what they do is to go for a breast implant, to put something that looks like a breast. in that place. So if you see that person, you think the person still has a breast. Meanwhile, the person doesn't have breast, actually. So it's common in their own environment. So we are still talking about the risk.
Yes.
This is one I've mentioned about something that goes in the family. The next one is what we call early menarche and late menopause. Menarche is what we call puberty, but that's the time a girl child starts to see the menstrual flow for the first time. Okay? So, in some climes, it comes between the ages of 9 to 12 as puberty, age of puberty. Then some, it comes by 10 to 14, some even up to 15 years. Even some people up to 16 years, that's when they start to see their menstruations. So if for any reason, a child that is 8 years or 7 begin to see menstruation, that's what we call a precocious puberty. That means this child is not yet at the age of puberty, but she has developed all the paraphernalia that you can see. This is puberty. He has a breast if it's a girl. He has pubic hairs, axillary hairs. The same thing with male. Okay, so if somebody have this menstruation early in life, that means the number of months the system are being barraged with all these hormones will be longer than those who started late. That's one of the risks. Then those who have late menopause, the age range for menopause, that cessation of menstruation, is 45 to 55 years. Even some has even come up to 40, from 40 to 50 years. The standard from 45 to 55 years. But for any reason, someone who is above 55 is still menstruating. So you say that individual is having late menopause. That means, for instance, if that individual started seeing menses at the age of 10, and at 60, the person is still seeing menstruation. You see the number of years the systems has been exposed to these high hormone levels is higher than those who may started 14 and ended by 40.
40 years.
This is one of the risks. Then 2 is the time the person begins to have a child. People who have their first child at the age of 35 and above also have higher risk of developing breast cancer, because it has been documented that breastfeeding is protective against the development of breast cancer. So you can now see why it is recommended that people should do exclusive breastfeeding. And the World Health Organization recommends that people can breastfeed their child up to 2 years. You see, it's not only because of the malnutrition that follows with inadequate feeding that you see in children, especially in developing countries where the economy is very hard and people are not feeding properly. So if you have a baby, let's say at 1 month, if you started giving this child pap, and what is in that pap you are giving the child? These are the issues. People cannot even afford the infant formula.
It's not very expensive.
It's very, very expensive. So, but breast milk is not expensive.
Yes.
You see, no matter what the woman is, the milk production will be there for the child. So it's not only benefiting the child, is also benefiting the woman. And you can see what our ladies are doing now in the modern world. People don't want to breastfeed again. They say their breast is going to fall, things like that, if they breastfeed a child, which you know is not true. Breast falling is about age. There is no way you can see an 80-year-old woman and her breast is still standing. It's not possible. Because there are changes in the body. People, as your face looks now bright, when you begin to age, you begin to have wrinkles. You know reason.
Yes.
Because the cells and tissues in your body are aging. You know.
But
So we are still on the risk
on
factor.
the risk factor. But
There are
before
many.
we move to the next risk factor, I'm sure a lot of people would want to confirm or just have more clarity. We've seen younger ladies with falling breasts. What could be the reason? If age is the major factor, then what is the reasons for this? I'm not going to laugh.
It's okay. Age is a sacrosanct. It's a natural phenomenon. But there are other conditions that can make the breast to fall. The commonest of it is the size of the breast. People that have huge breast that is big, because of the effect of gravity, the weighing on it, and what you call a suspensory ligament. There are ligaments that help to suspend this breast so that the breast looks pointing. So this weight over time will make those ligaments to lax and the breast will begin to fall. There's one aspect. Two aspects that people who actually don't go out with bra. Yeah, there are. It's something in vogue currently. They call it something braless or something like that. You know, you see them on campuses. People go around without bra. So as you go around with that, so there's no support. As you move, then the force of gravity is more on that breast. It will also make the breast to fall. People that undergo sports, okay, you run.
Yes.
That pressure that weighs on the breast also can equally make that breast to fall. Then there are other conditions. There are what we call, a kind of collagen abnormalities. Collagen is what makes most of the things in the body to look smooth, in a layman's understanding. So if they have this collagen disease, it makes their breast to be the skin and the quality of the breast tissue to be thin, or if you can use that word, light, that's easily stretched. Okay? Some of them comes down with what we call a phylloides tumors. You see the breast, you just do as if it's a rubber, extending. It can even go up to the waist. A breast is stretching. You know, these ones are actually genetic. But the other ones I've mentioned is what individuals contributed by their lifestyles, which they don't even know why they do those things, that can actually get the breast to fall.
Okay, doctor. All right, moving ahead, let's look at the stages.
Yeah, the breast cancers actually have, broadly speaking, two stages. Have early and late. Okay? Then how do you now know those that are early? You can only know that by investigating any lump that comes appears in any breast. So, this lump, how do we investigate them? You can either biopsy them. Biopsy means to take something from something. At this point, it is the lump. That is actually a growth that you have identified. You take the biopsy sample to pathologist, because the management of this breast cancer is multidisciplinary. It's not only one team of doctors that will manage the individual. That's why it is done in tertiary institutions, where you have different departments of doctors who will be involved in managing this patient, because it's not only one person.
Yes.
So the surgeons will do the biopsy and send it to pathologist. The pathologist will now look at the cells, because there are normal cells in any part of our body, and they are unique to those areas. When there is abnormal cells in those tissues, that's when you say that this person is developing a cancer, because cancer is actually something that is abnormal. Because it starts from the normal. It's as a result of replication or division of cells, which happens normally, physiologically. That's why if you have an injury, it heals on its own. And sometimes you look around, you won't even notice that you had something here after some years, something like that. That means our body is shedding off things that are old and replacing it with something that is new. That's why you see some people there, they say every year young, something like that. You know, so
looking fresh.
Exactly. So when there is alteration, the check and balances, because there are check and balances in these divisions. So if anything happens, that one of the regulators that will say, okay, stop, you have divided up to 100. 100 is okay for you. If that thing has any problem that it can't tell that cells that you've already divided up to 100, that cell will keep on dividing up to 500, 1,000, 2,000, 3,000, 4,000, 5,000. So you can imagine a place where a cell that's supposed to be 100 only in number to sit, and we're now having 1,000 copies of them sitting.
Wow.
You see, that's how this thing develops. So for cancer to happen, there is alteration in the body regulatory mechanism. So these early stages are diagnosed by pathologists, because they will use microscope and some special stains to stain them and look into them and say, hey, there's an abnormal cell. There's an abnormal cell here. And once that happens, they begin to characterize them to say it is this type or it is this type. There are other further tests they do that will also determine the genes and the receptors that are involved in this. That will help in the treatment. So these are early ones. Then there are things you see also in this lump. If a lump in the breast, you touch it, it is hard as a stone. You know that one is more likely to be a cancer.
It's the R for me.
It's more likely to be cancerous than something benign, something not serious. So the late ones are something that nobody will want to have. At that point, the breast is reddish, the breast may be ulcerating, maybe discharging blood from the nipple, maybe have some lumps, something like Luke's lump, including in the armpit. Yes.
But can it be categorized as breast cancer as well?
No, the lump in the armpit is what we call metastasis.
Okay.
That means that the cancer has started spreading
Oh, to other parts.
To other parts of the body, yes. And you can only see that majorly in the late aspect. So once that cancer has left this breast and went to somewhere else, it's already late. It doesn't matter even if the breast still looks normal, because it can happen. But the breast is still normal, but as it is. That lump that's inside, the person didn't notice or didn't take cognizance of, or didn't call it something serious. Maybe throwing out metastatic cells to different parts of the body.
Wow.
Let's talk about treatment.
Treatment, yeah.
Yes. So what is the treatment for breast cancer? And you said it's curable, of course, when detected early.
Early, yes. It is.
So it doesn't mean at that point there's no need for surgery once it's detected early?
No.
Okay, so take us through the treatment.
Treatment, yeah.
Well, actually, there are, broadly speaking, 3 modalities of treatment. So number 1 is surgery.
Surgery.
Yeah. Number 2 is chemotherapy. Number 3 is radiotherapy. If you when talk about radiotherapy, people may not understand that the common thing you can use to equate is X-ray. So people say they want to go to have X-ray. If you mention that, it's common. So radiotherapy is a form of X-ray. Okay. So these 3 modalities are important in achieving cure in somebody who has a cancer. But you may not use all the 3 in every individual. It depends at the stage the individual comes. Then, and the fitness of the person, yes. But there are people that will come, they will actually not be fit for you to do all these 3 on them.
So what qualifies a person to be fit?
Fine. For you to be fit to receive all these treatments, 1, your blood level should be fine. Okay? 2, you will not be having issues with heart problems, liver problems, kidney problems. Because all these things that are going to be used in treating them, these organs in the body are the ones to metabolize them and remove them from the system. So if these ones are already weak and you expose that individual to chemotherapy treatment for cancers, the person can just die.
Wow.
Because it will be overwhelming. That's why before your doctor starts you on treatment, they say, we are going to do some investigations, tests for you. Some people don't really understand it. They think a doctor wants to collect money or things like that. No. It is for the doctor to make sure that your body system is fit to receive this treatment. Because the treatment is also strong to the body.
So are there side effects to any
treatment?
This treatment?
Of course. There are. In fact, the one the people complain about is about hair loss, yes. Hair loss, which actually is temporary in majority of the cases. The hair loss is actually temporary in majority of the cases. So maybe after about 6 months to 1 year after the treatment, the hair will grow back. But people see it as a nightmare. That my hair suddenly all gone off because I started this drug.
The hair loss, does it attribute to all the treatment scenarios or just one particular treatment?
Why we're having hair loss, especially here in our environment, is that the drugs we use are actually not specific to the cancer cells alone. They also affect normal cells in the body. That's why in the Western world, they are moving into what we call targeted therapy. So a lot of drugs are evolving that can actually target only the cancer cells and leave the normal cells in the body. So we are moving in that direction. But for us in the developing countries, we are odd because they are very expensive.
I was about to ask you prices.
Well, for me, the prices shouldn't be a deterrent for somebody to seek for help in the hospital, because there are some provisions in the hospital. At times a philanthropist comes around and said, we're going to pay for everybody in the hospital. You can see some people who have taken treatment in the hospital and they are owing, they can't pay, and they won't be able to go home. And one day somebody comes and say, where are people who, you say, some people come and pay as high as 20 million, offsetting the bill of maybe 10, 20, 30 patients. One individual.
And you've experienced this before, life?
Many times. In fact, it's very common during the festive period, Christmas and Easter celebrations. They do come at times within the years, but this period, you have many of them coming. They come to the hospital, you don't know them, they don't know you. They don't even, so many of them don't want even to see the patient. They go to the management, say, I want to pay for patients. You see, that's why we used to tell people, don't just stay at home saying, I don't have money to go to the hospital. In fact, I have seen a situation where a patient that is in the ward waiting for surgery paid for another patient.
Wow.
That his own surgery is already due, but he doesn't have money. He hasn't done his own surgery, but he paid for another person. You know, so these are the benefits that our people, many of our people, actually look for one another. You can see a patient that has maybe for dressing materials, the other person doesn't have. You say, take from my own and do the dressing for another person. He doesn't know the person, he's not his relative. But out of empathy, he finds that I'm better than this person. I was able to buy 4, give him 1 from my own.
Just a quick question. Are the government, are they playing the same role as individuals, philanthropists?
Well, government will not do a work of a philanthropist. What the government needs to do is to domesticate the National Health Insurance Scheme to make it universally available for everyone. It is there, we have it, but it is for few. Many of our people in the village doesn't know anything about that. Everybody needs to be cued into that. And with that, you see people will be coming to hospital on time. And all the people that will be dying from this will be markedly reduced. Because the major reason why people don't come early to hospital, you say, there's no money. So they will be going to the chemist buying 1 or 2 until it begins so bad. Now they still come. They don't have money.
Doctor, if we had time, we would have stayed and discussed more. I still have more questions I want to, but because of time, this is where we have to let you go. Thank you so much for your input and your expert insight on this.
You're very much welcome. It's a pleasure, having to talk to our
And
people.
of course, viewers, you can drop your questions on our Facebook, on our YouTube, whatever it is your concern is. We would relate it to Dr. Solomon, and he would get back to you through us, of course. So please, let your questions, drop them. I know I still have more, so I'm going to go and drop mine too as well.
Yeah.
Thank you very much. That has been Dr. Solomon educating us and giving us information that's very important concerning breast cancer and its mitigation. We'll go on a very short break. When we come back, we'll have more segments lined up for you.